Hi, I'm Connie Dahlin. I'm a nurse practitioner in palliative care. I've been a nurse in hospice and palliative care for over 25 years. I practice clinically as a nurse practitioner with a palliative care service at the North Shore Medical Center in Salem, Massachusetts. I also am director of professional practice with the Hospice and Palliative Nurses Association. I think the issue for me was that when I first started a number of years ago, there wasn't really education for nurses about palliative nursing and end-of-life care. And now with ELNEC and all the different versions, we really have the opportunity to help nurses provide best care in whatever type of practice they have, from the emergency room to critical care to working with geriatrics to pediatrics, wherever they're really taking care of people with serious illness, even if they don't designate themselves as a hospice and palliative care nurse, that we know they need this education, and it really helps them give some confidence to the practice and validate their practice. And so the great thing about ELNEC is that it's been constantly updated, so it represents the constant state of emerging research and the state of practice, as well as really reflects what nurses are doing in the field. And so that's the exciting part, that we know that we've helped a whole bunch of generations of nursing to get the best education and really promote quality and access to care for their patients. So the focus of my work has been with APRN ELNEC, and the real challenge was thinking about all of the different components or modules that APRNs would need to practice and to lead programs. But if I think about the module that really means the most to me, it's really the communication module, because communication is really the foundation to our practice. And if we don't know how to communicate, we're not going to be able to work with patients or families or our colleagues. And so it was really almost hard to think about containing all that people would need to know to practice in that one module. Yet I think the beauty of it is that we give people the principles to remind them the importance of palliative care communication and the importance of our different styles, and giving people the tools to practice these skills. Because one of the things that's different about nurses in general than our other colleagues is we don't get the type of communication experience in our graduate or undergraduate programs. Usually there isn't enough money to do simulated patients or simulation. So when APRNs are coming to ELNEC, it's saying, okay, let's talk about this communication. This is so essential to your practice, so essential for you to be able to succeed in assessing and managing and thinking about your treatment and evaluating and talking about your results with both your patients and your hospital, that it's, to me, the most exciting, because we also get to recognize the regional differences of communication, some of our educational differences, and just some of our cultural differences coming into how we would communicate, and building on that so that people can really come out of it and say, I know that I can be a good clinician and really work well with patients and do my work well. Attending APRN ELNEC is really important for any advanced practice nurse who's going to be taking care of patients, because across the spectrum, whether they're in primary care, women's health, doing psychiatric care, they're going to be having patients who are going to get a life-threatening illness and ultimately die. And since we know that most APRNs do not receive a lot of education in their graduate program, coming to ELNEC provides them with the tools to bring back to their practice and think about starting conversations as, what are people's quality of life? What is really acceptable and unacceptable quality of life? And then thinking about, if you get ill, how are we going to think about what treatments you want and what treatments you don't want based upon that quality? And what's your circle of care that with your family and your other clinicians? And finally, what are resources available in your community? So coming to APRN ELNEC really gives advanced practice nurses this 360-degree perspective of all the components of doing good care, which they can incorporate with any patient, whether they're specializing in palliative care or they're doing primary care or women's health or oncology, any of those, just so that they really know that they can take care of the patient from the beginning of a diagnosis through their death and support the family.